Welcome back to Ophthalmology for undergraduates and postgraduate beginners. In the last video, we saw about the subconjunctival hemorrhage. In this video, let us see what is the role of medicines in the treatment of subconjunctival hemorrhage. Let me first tell you about what is the role of lubricants or artificial tears in the treatment of subconjunctival hemorrhage. Most of the people with subconjunctival hemorrhages do not have any symptoms, but some people with subconjunctival hemorrhage may present with irritation in their eyes or burning sensation in their eyes. You can see in this picture, I have drawn the cornea, the iris and sclera in black color. Over the sclera, I have drawn the conjunctiva in blue color. This side you can see below the conjunctiva there is collection of blood, that is the subconjunctival hemorrhage. You can see in this picture there is an uneven surface in the portion of the eye where there is a subconjunctival hemorrhage. Normally the tears which are being secreted by the lacrimal glands are spread over the cornea and conjunctiva uniformly with the movements of the lids. Because this portion is irregular in its surface, what will happen is the spreading of the tear over this raised portion above the subconjunctival hemorrhage will not be adequate. Even if it is spread over that raised surface, this raised surface will naturally going for yearly breakup in the tear film. It will get dried up earlier and faster. Once it is getting dried up, this portion will have a burning sensation or it may cause irritation or foreign body sensation in the eyes. To prevent this, we use lubricants or artificial tears which have a consistency little bit more than our normal tear film, so that this portion is covered by these artificial tears and that will not cause irritation or foreign body sensation in the eyes of the patient. These artificial tears and lubricant eye drops are not going to cure the problem immediately, but they will reduce only this symptoms like irritation, foreign body sensation or burning sensation in the eyes. Now let us see what is the role of antibiotics in the treatment of subconjunctival hemorrhage. Usually for subconjunctival hemorrhages, antibiotics in the form of drops are not needed. Then what is the role of these antibiotics in subconjunctival hemorrhages? Whenever there is an associated infection in the surface of the eye, either it may be in the cornea or in the conjunctiva, you can use this antimicrobials. Whenever there is a break in the conjunctiva, you can see here there is a break in the conjunctiva, there is a conjunctival tear along with the subconjunctival hemorrhage, then in order to prevent the infection, we can prophylactically use antibiotics so that the cut portion or torn portion does not get infected. So, antibiotics topically are given when there is an associated infection or when there is a breach in the surface of the eyeball. Now, let us see what is the role of anticoagulants in causing a subconjunctival hemorrhage. People may be taking drugs like aspirin, clopidogrel, heparin or warfarin for treatment of several vascular diseases in the body. These people, even when they have a minor or a trivial injury, these vessels, when they break, there will be a profuse bleeding. So, that will cause bleeding in all parts of the body as well as the subconjunctival hemorrhage. So these drugs, when the patient is already taking, may be the cause for the subconjunctival hemorrhages in these patients. With this, I will stop here. We will talk about some other topic in the next session. Thank you.